This is the left hemisphere of the brain, and it shows you the main functional areas. The brain is color-coded. The area in purple is Broca's area. It's in the inferior frontal gyrus. This is the inferior frontal gyrus. This is shows the topographic organization of the primary motor cortex. This will be the central sulcus. Precentral gyrus is where motor cortex is located. Postcentral gyrus is this purple strip here, dark purple. Okay, and this is cortical areas 3, 1, and 2. This is the parietal cortex that this is primarily responsible for somatosensory processing. Then the primary auditory cortex is located right here. The painted area shows that it's in the upper part of the transverse fissure, but the actual auditory cortex is on the superior temporal gyrus. It should be down here instead. They just painted the wrong part. So this is where primary auditory cortex is located, where the green is, but on the superior temporal gyrus. Primary, this area here is for speech, Broca's area. And then the language area would be this area right here. Okay, this area here is called Wernicke's area. And it's for language. So if you have a lesion here, you may be able to talk, but the words that come out of your mouth is called word salad. Okay? Just random words come out, it will not make any sense at all. And people who have a lesion here cannot comprehend anything that you say. Okay? They lose that ability. They lose the ability to comprehend language. Whereas the person that has a lesion here may be able to comprehend language, but they just cannot speak. They lose the ability to speak. This area here is the primary visual cortex in green. Most of the primary visual cortex is buried deep in the calcarine fissure, and it's surrounded by visual association cortex, which is located here. This is called V2, cortical area 18, V1, cortical area 17. This is primary visual cortex. Secondary visual cortex, area 18. And then tertiary visual cortex is right here, cortical area 19. So it's 17, 18, 19. Okay. And at the base here you have the temporal lobe. And in the medial view of the left hemisphere, we have the cerebellum, fourth ventricle, cerebral aqueduct. The third ventricle lies between the two sides here. This is where the diencephalon is. The thalamic nuclei are located here. The hypothalamus is located right underneath the thalamus. So if this is the thalamus, this is the hypothalamus. And attached to the thalamus is the pituitary gland, right on the bottom here, so where the pituitary gland would sit. So the hypothalamus would be considered your visceral brain. It controls your autonomic nervous system, both the parasympathetic and sympathetic nervous systems. And it also controls the endocrine. Much of the endocrine system is also controlled by the hypothalamus, because the hypothalamus releases what are called releasing factors that trigger the release of hormones in the anterior pituitary gland. And the anterior pituitary gland is considered the master endocrine gland, but that is under control of the hypothalamus. This is the corpus callosum. And the corpus callosum is the largest fiber tract in the brain. It connects the right brain with the left brain so that the right brain and left brain know what each other are doing, basically. The gyrus that surrounds the corpus callosum is the cingulate gyrus. The cingulate gyrus is where emotions are created. So emotions are not created when you feel something and someone breaks your heart. Okay, the heart's just a pump. It's given all the credit for what the cingulate gyrus does. So the next time you send out Valentines, make sure you show them a picture of the place where love really is. It's in the cingulate gyrus, okay? Not in your heart. I don't know, I guess it would be kind of sad for all the people who make Valentine's cards to realize the truth. Anyway, so, let's see. This area is the pons. The area beneath the pons is the medulla. Okay, again, this is the fourth ventricle. The midbrain lies between the pons and the hypothalamus. This little wedge area here is the midbrain. And you have two bumps here. The lower one is called the inferior colliculus. It mediates auditory reflexes. The rostral one, the upper one, is the superior colliculus, and it mediates visual reflexes. So basically, the midbrain area mediates visual and auditory reflexes. The pineal gland is located right here at the distal end of the diencephalon, and this part here is what is called the epithalamus. And this is the epithalamus. It lies above the thalamus, and it consists of the habenular nuclei here and the pineal body. And this is the diencephalon, which is mostly the thalamus. It's also called the dorsal thalamus, where all the thalamic relay nuclei are located. And beneath the thalamus is the hypothalamus. So epithalamus, thalamus, hypothalamus. Then this fiber bundle here that comes down from the base of the corpus callosum is your hippocampal. There's a hippocampal fissure here, and also this fiber bundle here is called the fornix. And this is called the fornix. And the fornix projects to the septal nucleus here and the mammillary nucleus, which is located at the posterior end of the hypothalamus. The mammillary nucleus in turn projects to the anterior nucleus of the thalamus. The anterior nucleus of the thalamus in turn projects to the cingulate gyrus right here. Cingulate gyrus projects to the hippocampus. Hippocampus gives rise to the fornix, and you have a complete circuit. Okay. Let's see. On this one, this is the right hemisphere. You have the pituitary bulb. The pituitary gland is present on this half of the model. Now, if we look at the side here, we can see the cranial nerves. So cranial nerve 1 are the nerves that pass through the cribriform plate and synapse with the olfactory bulb here. So what you see here is not cranial nerve 1. Cranial nerve 1 is passing from the nasal epithelium through the cribriform plate and the synapse in the olfactory bulb. And this is the olfactory tract. Olfactory tract has a projection that goes to the amygdala, which is right here, where you have emotional memories. And then there's another part of the medial olfactory tract will pass through the anterior commissure right here, and that projection will help the olfactory system determine where a particular odor is coming from. Okay, because the olfactory system is used for odor localization, and if the smell is coming from one side, the intensity of the odor should be a little stronger on the side that the odor is coming from. And so when you see a dog trying to track a person, or it has a scent trail, the dog is sniffing back and forth like this, okay, so that it can readily tell which way the scent is coming from. Okay, so that's cranial nerve 1, is the olfactory nerve. Cranial nerve 2 is the optic nerve. It carries information from the eyes to the brain. And this part here is called the optic chiasm. And the part that extends backward is called the optic tract. So cranial nerve 3 would be coming off, let's see, between the two peduncles. So one peduncle is on that side. So the cranial nerve 3 would be coming out this way. Cranial nerve 4 would be wrapping around the dorsal surface of the midbrain, and it'll come around to the front this way. That would be cranial nerve 4. Cranial nerve 5 has its origin on the side of the pons. Cranial nerve 6 and 7 and 8 are located in a medial to lateral direction. 6, 7, and 8, medial to lateral direction at the pontomedullary junction. Then cranial nerve 9, 10, and 11. 9, 10, and 11 occupy the lateral part of the medulla, and cranial nerve 12 is the only cranial nerve that exits anterior to the olivary nucleus, which is located right here. Okay, the olivary nucleus is located right here, and then so cranial nerve 12 is located medial to the olive. Cranial nerve 9, 10, and 11 are located lateral to the olive. Okay. All right, that's all I have for this particular